All right. Hello, everybody. I don't know if anybody's here. All right, so we'll be starting in just a couple minutes. We're going to wait for some more people to show up so that they can hear this information probably first, rather than having to watch later. If you guys are watching, go ahead and just type below. I want to make sure that this chat is actually working so I can read your questions if you have any. Hope everyone is having a wonderful Christmas break before they head back to the island and finish up their last term. And if you just finished your last term, congratulations. You now are into the designated study time, and it's going to be a lot of work, but definitely worth it. And you'll be amazed at how much you're going to learn in the next few weeks before your exam that you didn't before. And that review is very important. So that's kind of what we're here to talk about as far as earlier term students, fourth term going into fifth term, and kind of how you handle fifth term, how you handle your review time, how you prepare for your exams, especially like BSE2 and CBSE. And then some additional questions that I get from students a lot in regards to like DES sessions and what are the courses entailing me to do, and how much time am I gonna have to do studying. In addition, how much time I'm gonna have to do practice questions, and then how am I gonna choose what program to use if I'm going to choose a program for step one. All those questions are things we're going to cover today. So we'll wait about one more minute before we go ahead and start. And I will stop throughout each of the sections after I go over a couple, and then allow for anybody to ask questions to me in that designated time about things we've covered so far. We'll have a couple of those times to stop and answer those questions. So just hang on to your questions until we hit those times, and we can address them appropriately at that time. I hope everyone is doing wonderfully today on this wonderful Wednesday. Looks like I got 24 people here. All right, so let's go ahead and start. For all those who are watching, we will be going into a little bit. So if you don't know me, I want to introduce myself, I guess. My name is Clark. I am a third-year medical student. I have done several rotations so far at this point. I finished internal medicine, surgery, and I just came back from Miami to California for my pediatric rotation there at Nicholas Children's Hospital. I currently work for med school tutors as a tutor through that program, preparing students for their board exams. I have tutored many DES sessions while I was on the island. In addition, I have also privately tutored many students for medicine. In addition, I've also tutored pretty much since I was in high school for all sorts of classes. And so that's why I've been pretty good at teaching and stuff. And that's why I actually ended up putting my YouTube channel together. Was not only was it helpful for me, putting everything that I was learning into a way that I could teach it, but I know it also benefited other students by kind of hitting clear and concise points, hitting what's high yield on questions, and how tricks are kind of thrown into questions. So if you've watched my videos, you have probably seen me kind of go over those things and touch upon like, hey, watch out for that, or bam, that's the answer right there. Those are things that I like to say throughout the videos, kind of pointing those certain things out. So that's a little bit about me, how I learn, and this is something I want to kind of tell you guys as well as we start and go over this. How I learn is getting all my information to where I can teach it, but it also is the point where I like taking information, right? We're getting all these lecture slides with all this detail and everything like that, and it's just crazy. All these PhD doctors are putting up all this stuff with all these too much details, and it's just kind of listed, and it's hard to get what the big picture out of it is. And so it does take a little bit of practice, but I learned how to do that and get what is the big picture from something, and then dive into the details once I understood the big picture and made analogies or fun things to remember things, mnemonics or whatever it is that everybody else uses. I use some of those sometimes. And that's how I kind of studied. And so my basic aspect of getting information together was diving in, making sure I understand about 80% of material before I start approaching questions. So that's me personally. I know a lot of students that like doing questions first, instead of learning everything and then doing questions to test what they know. So there are two kind of main groups of students there that do that. And so I'm going to be approaching it from how I learn. And if it hits you strongly there, then I would suggest trying to do some of the things that I'm going to be talking today about. But I also will try to approach some of those students from the other side that like doing questions more right off the bat. And this is very important because term 5 is sort of a review term, but they've changed your curriculum a little bit. So now that you're actually now learning new information during term 5, and so your review is not going to be as strong as like we had during our curriculum. You're going to have a large section at the end of your term, I believe, where you're going to have kind of a broad everything review time. And this is where my approach to this might be able to help you. So that's kind of an introduction today. So let's talk about what is term 5. So term 5 for you guys in your new curriculum is going to be sort of a continuation of everything you've been doing during term 4. And so that includes your micro and path and farm related courses that are all units based on your systems that you haven't covered. In addition, there's going to be everything related to your clinical courses. You're going to have lectures on your 4th term equivalent CPD, is now called Introduction to Clinical Medicine, or ICM. And this is where you guys are going to be able to go to the hospital and do little rotations once a week and stuff like that. You're going to be having lectures about clinical skills, which is sort of random and not super helpful most of the time. But then you'll also have kind of small group sessions where you're going to have those test patients, and you're going to really get to hone in on emergency situations. In addition, your physical exams kind of sharpen those up, because when you get to clinicals, you don't want to be that idiot on the floor that doesn't know how to do a physical exam or how to explain or present a case to an attending physician. This is the class that is going to really strengthen those things, and you're going to need to work on that really hard during this term so that your 3rd and 4th year is going to be no problem at all. I want you guys to be that student in the hospital that kind of stands out on those kind of things. And not only is your science basic knowledge important, because you do get punked and asked questions about certain things like that, but also very important on how to present that information to an attending physician, what is important from the patient's case, what physical exam you did on that patient, what history you gathered from that patient, and organizing it appropriately. And so when it comes that time during third and fourth year, I know you're like, oh my gosh, I still have term 5. This is the time that you're actually going to learn how to do that. So definitely during your term 5, pay attention in that small group session. Ask the doctors questions. How would I present this part of the history or something to an attending physician? And they'll really help you. It's a great experience that you're stuck in a small group anyways, so might as well ask questions while you're there and learn instead of wasting that time. And so that's why ICM, I think, is very, very important. And okay, I will answer that question, Taha, when we get to the question stuff. As far as pathophysiology and BSFCR, this is all going to be, I mean, pathophys, they'll probably be teaching you throughout the term, but BSFCR, I don't know if they're going to throw that in at the end. And that is going to be something that's very important for your review. So BSFCR was a class that I had in my term 5. That was pretty much every week we did a system, and in that system we reviewed everything from histology to biochem to everything anatomy through your pathology and pathophysiology related on that system. And it was a really great kind of teaching aspect of how you're going to review during designated, how you review for your BSE2 and your CBSEE, and it was a really great approach. And so we're going to cover that a little bit later, kind of how you meet with a friend once a week for a couple hours and review your material, everything, because you're going to go, oh my gosh, there's 2 years worth of information, and how do I retain all of this for my step 1? In addition, then how do I review it? How do I answer all my questions? How do I do all my questions? And then how do I take step 1? So all those things we'll be covering kind of in that section. So term 5, pretty much, you're learning your new material on your systems. You're doing your clinical-based course, doing the hospital, doing your small groups. You'll have small groups for pharm and everything like that. And then you'll have your kind of review time during term 5. Now, it is a lot. It is pretty busy. But some questions that do come up are, what do I do? How do I study for this material? So for micro and for path, you're going to be studying it the same way that you did for term 4. If it didn't work out, there might be certain resources that you're not using. I've met a lot of students that messaged me and said, hey, I'm struggling path. And I asked them, have you been using Pathoma? And they said, no. And I went, why? Because Pathoma is pretty much the answer questions to most of the exam questions that you'll have for path. And so definitely be using your Pathoma for path. If you're reviewing path-related physiology things, like if you're getting to a system like cardiovascular, which I'm not sure if you've already done already, I think you have, but there was a lot of physiology going into the path. Heart failure was a huge part of pathology, and it was nice knowing the histopath and such, and the difference between the cardiomyopathies. However, a big part was actually recognizing the pathophysiology in your path, and so that's sometimes that you can actually combine a little bit of review of BRS, physio, read that section before you start that associated system to get what is the normal physiology. And then when you get to your pathology related things, you know, okay, here's not only the histopath, but here's the pathophysiology that's wrong with the heart in this disease, that this was the normal, this is the comparison, and now you know normal versus abnormal. And that's a nice thing that I always threw in when I was studying for my path, was I was reviewing my BRS right before then. So that's one suggestion for path. For micro, use my channel. That's going to help you with your micro related things. And then obviously sketchy micro is going to help there. And for pharm, a lot of people hate pharm. I did understand the hate of pharm before I got into it, but then I ended up actually loving it. It was actually one of my favorite classes because it was very puzzly. I like puzzles. I like thinking through different cases of puzzles. And so that's something that I really enjoyed. But the thing with pharm is how you study it and what questions are something you're doing practice with. And that comes down to lots of resources. The best, I would say, for studying the material is having a chart. Because there's so many drugs and different things that are important, the best chart out there so far is our Fern Notes, also called the Fern Ninja. It's just a Ninja, but updated with some things that are highlighted in red and blue and green that kind of hit the high points there. So that's nice to have a chart there and use that when you go into lecture, and as you're listening to the lecture, you can like annotate, or you can circle like, oh wait, this was the one adverse effect that they really liked. Here's a practice question about the adverse effect. Let me circle that, double circle that, highlight it, whatever, just to emphasize, wait, this does come up in questions. This is how they ask questions about this drug. And that's a very important thing to kind of do, is to have everything clear and concise of information-wise. But then when it comes to as far as your practice questions, what do you do for pharm? And that's where on my page I kind of recommended, and I posted some resources for pharm as far as practice questions. The best is going to be your Katzung book. You don't have to read the sections necessarily. I would just do the practice questions. They're fantastic and really relevant at hitting what is high yield for this drug over the other ones, and why is this drug in this section more important than the other drugs, or what are the weird things out of a group section drug. For example, in your CNS section, you learned all about your TCAs, for example, and there's 5 of them in there that you were given. There's probably more than that in real life, but those 5, they all have different kind of adverse effects that are stronger in one over the other. And there's always a question that's asking that particular point right there. And Katzung kind of hits those grouped section drugs very well on how to separate a couple within a group from the rest of them in the group. And so those practice questions are really, really great. And I should have posted that on my Facebook page. I'll check that later. If I haven't, I will repost that. And other books that I recommend, and I actually ended up doing a ton of practice questions. I did BRS, pharm, I did Lippincott, I did the Katzung ones, I did the Kaplan questions. I even tried to do a little bit of UWorld. I didn't like using UWorld that much because it was sort of wasting those questions for my designated time. There's a whole bunch of resources, like Pretest as well as another book of pharmacological questions that are really great, especially when it came to like the CNS questions. I actually did, I looked up a pretest psychiatry book. And in the pretest psychiatry book, they had questions about the drugs given for psychiatry. So they actually were pretty good for that section too. And so doing a lot of questions for pharm, I would recommend, in addition to analyzing the heck out of those IMCQs that you guys have for pharm. That's the best approach to pharm. And if you have any questions, go and meet with Dr. Kloons. She's very helpful. I met with her once a week and discussed, hey, here are my questions. I kind of wrote a nice page of questions I had as I was doing practice questions, as I was reading over the lectures, as I was reading over my Fern note chart, all those things. I came up with questions like, hey, like, is this high yield? Is this an important point? Is this often questioned on boards and such? Because the pharm department is very good at writing questions that show up on board exams, that show up in your UWorld, that show up in your USMLE RX. All those things kind of are asking high yield points. And so that's what pharm is really doing, is not only trying to teach you, oh, here's all the drugs and all the things you should know about it, but here's actually what the high yield point is, and that is what your exam is going to be about. So studying for pharm, doing it that way, is more important than just trying to learn every single detail, because you'll never be able to do that. That's impossible in the amount of time that you have for pharm, in addition with all the other things you're learning. So try to get, like, what is high yield? What's the adverse effect for this group that's more important? And then if there's group drugs, how do I separate a couple of those drugs from one another based on an adverse effect or contraindication or something like that? And that's pretty much how you handle pharm. ICM, studying for that isn't bad. It's just pretty much practicing your physical exam, your history taking skills, your closing statements, and working with the group, and your thinking process on the pace. It's just sort of an applied medicine. It's not that difficult to do. You'll have some papers or something you might have to write for that. I don't know, but that's not that hard. Now, before I get to how to approach questions for BSE and BSFCR, I'm going to go ahead and answer some of these questions. So if you have any questions at this point in time, other than asking about what Q banks I used, because we're about to talk about that, and how do I review for BSE2 and CBSE and what designated times and stuff like that programs, don't ask those questions. But if you have any, go ahead and ask those and I will answer them appropriately. Okay. So Taha asked, how much should we be studying, or what should we be studying during the break right now between term 4 and term 5? You shouldn't be studying that much. You should be enjoying your Christmas break. However, if you are going to be studying or reviewing something, I would review something of a subject that you absolutely hated. For example, I hated biochemistry. So every break I got, I reviewed biochemistry, as it was one of my hardest classes to take and work at learning. Now I really enjoy it because I did those reviews multiple times. I actually reviewed that 11 times outside of the actual biochemistry class. So take a class or take a course or take a subject that you just really, really did not like or felt was very difficult, something that you scored very low in or something like that you really need to work on, something you just don't understand. When you look back at that class and go, like I did like a couple things, but I really didn't fully understand that whole subject. That's what you could be studying right now during your break. And just simple review, 1 hour, 2 hours max a day. That's all you need to do over the break. Definitely don't do that on Christmas Eve or Christmas or New Year's or whatever. Just all those other days, if you want to do 1 or 2 hours review, just review that. Try to get a big picture of those things, then dive into a little bit of detail, little bit of detail. And that would be enough of a review. Other things that you could do as well that I would suggest is reviewing your farm. Farm is really hard because there's so many drugs and so many little tiny things that you can forget. So reviewing that as much as you can is going to help you during your designated study time after term 5. That when you get to farm, you're like, oh yeah, I already know that, click, 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 click. And you don't have to waste a lot of time reviewing over and over and over and over farm during that time. And you can focus on bigger topics like physiology and cardiovascular system, or physiology and respiratory, which I know like everybody hates. Right now it would be nice if you were to pick a subject. I would say farm is one of the most important, or biostats and epidemiology. Biostats and epidemiology everybody hates because it was not taught that well at SGU. However, it is a very easy topic. And yet everybody, and myself included, we always miss questions on biostats and epidemiology, and there's going to be a very large amount of questions on those subjects on your BSE2 and CBSE, and that's one of the downfalls of every student, is that section, I think, until they get to designated and really dive into figuring out what's happening in that section, that they can start to get questions right. And so if you struggle in that section, I would definitely review that now. Try to get those formulas down. Try to understand what the formulas mean and why I'm looking at those and what they represent and what I would use those for as a researcher, as a doctor. What would I use those for? And if you have any questions about biostats and epidemiology, please post it on my Facebook page. I would love to answer questions about those. I'm very good at biostats and epidemiology now that I've worked on it and turn one of my weaknesses into my strengths. So if you have questions about that, or if we want to make a vote on like having an hour session where I kind of go over biostats and epi, I can do that as well. Sometime over this break, I might be able to kind of break down a little review, how to kind of go over that material. I do that as well. But those are two kind of things that I would suggest right now for you to study, either that or not at all. Okay. Yes, Desi, the video will remain up. It actually will be posted onto my YouTube page, so you can kind of go back and watch it. You can watch from the beginning as well and see what's up there. Okay, so Stecker, Pearson. So the general term for consensus is that it really feels like the exams are avoiding specific coverage covered in Pathoma, so end up having a lot of information that's not useful in the exam. So let's dive a little bit into Pathoma, because you are right, but lecture also has too much information. And so the way that pathology works and how Pathoma applies there, Pathoma gives you the broad concepts. He helps you understand the physiology of a system before you dive into it. He explains the basic pathology, some high yield points like, hey, these are the key things you're looking for this disease. This is the key risk factors, which are super, super important. These are the key complications of that, and they've always been stagnant and remaining. Those are going to show up on your UWorld. They're going to show up on your step 1 all the way. It's going to show up on your step 2. It's going to show up on your internal medicine shelves. All those things as far as pathology always show up, always. They don't change. They can't change that because pathology is pathology, and they don't really often change the descriptions of things. And that's going to be about 70 to 80% of the material. That's where Pathoma kind of really hits those things pretty hard. Now, does that mean you're going to get a 70 and 80% on your exam? No. It's just that 70 and 80% means you understand 70 to 80% of the questions, what they're talking about, and then you have to use your brain to kind of figure out and be able to answer 70 or 80% of those questions based on that knowledge there. The remaining part of that is going to be the details they give in lecture. And so what I always did was I always post-read lectures, which is very important, but I did Pathoma first. I did my Pathoma, I reviewed, I annotated into my Pathoma everything he was saying because it was way more than what it was just written on the Pathoma. I drew his pictures, I helped understand the broad concepts. That gave me the big picture. Then I took my lectures and went, okay, I now see the big picture in my entire lecture I had. What are the fine details that my pathology class wants me to learn from the lectures? And that is where I added in a little extra detail. I had the big, broad wire net, big picture there. But then what are the little fine details sitting on top of that that I need to get from the lecture? And that's where the post-reading lecture is very important. It's not an all or one, just do Pathoma and you're going to get an A. That doesn't happen. That just doesn't happen at all. It's what is the big picture so you understand what's going on and you can approach almost every single one of those questions. But then what are the details that my class likes to kind of point out and ask questions about specifically, right? Hypertrophic cardiomyopathy, for example, they talk about, oh yeah, you got your banana-shaped lumen, you have your very hypertrophed interventricular septum that's kind of filling in that space, you have the obstruction that caused when you have decreased preload. All these things are like very important, and Pathoma hits on those. But then it also says, okay, well, also on histology, here's what it looks like. But then in your lectures, they really emphasize, okay, these are the genes and these are how they are inherited, or this is a symptom of that presents. And Pathoma doesn't often hit on those miniature details. And that's where the lecture kind of goes, oh, this is actually what's important, and we can ask questions on. Now, there are going to be a lot of questions based on everything Pathoma talks about, but there will be quite a bit that the lecture wants to give you in there. And so that's why I always suggest for students to put those two together. So hopefully, Stecker Pearson, that helps. If you have any further questions, Stecker, go ahead and message me on Facebook. I would love to kind of approach what particular questions you have and give you any particular suggestions about that. Taha, I think I answered your question. Stecker Pearson, if you're reviewing, do you use lecture notes or step prep resources? Stecker had another good question here. And so I do use lectures, but as far as, step prep resources, Stecker, if you can be more clear on what you mean by that. Do you mean like Kaplan, or do you mean like first aid sort of stuff? I wouldn't suggest first aid unless you're doing broad review, and that's during your term 5. I wouldn't have done that during term 4. That wouldn't have been that wise of a choice, because it's not everything that's going to be covered. So Secker, if you can please be more clear as far as what step prep resource is, and I'll answer that in a second. Taha, do you recommend studying for STEP the day we start term 5? Absolutely. I would definitely suggest that. And we're going to be talking about how to do a broad review and a detailed review with a study partner in just a little bit. So Taha, I think I might be able to answer that question a little bit later. If I don't, ask it again, please. After we finish the new material in the first 6 weeks, how do we recommend to study for BSc and NBME? Okay, we'll cover that in a minute as well. What resources do you recommend for immunology? Okay, I get this question actually a lot. I did post on my Facebook page a book that is very short. And if you want to study immunology over the break, because I know a lot of students struggle with immunology, that's your book that you go to read during your break. It's pretty much, it's an orange book, I think. It's something like something to do with immunology. I can't remember the actual name of this, but it's pretty much a very basic understanding of the different systems of immunology, the different cells within your immune system, the different organs in your immune system, and how they all interact, how they communicate, what are some of the cytokines that interact between them, and what those cytokines do in between them, and why they're used at those particular infection times. And then what happens genetically as far as its response, like how do we make different immunoglobulins, IgM versus IgA versus, like why do we use them, what do they do? And then how we make memory and vaccines, like how are vaccines important for immune system and such. So it's very, very good. It's sort of a broad picture, but it is so amazing at how much you'll understand from immunology just by reading that book over most students' knowledge coming out of your immunology lectures from SGU. SGU, actually, I had Dr. Budikov as our lecturer. I don't know if you guys still have him there. I think he left. But his lectures were so amazing. They had everything there. It was all there, very nicely organized, and it was all the details that were super high yield. However, for a student that hasn't taken immunology and hasn't read this book, it looks very like, wow, there's way too many details. I don't know what's important from here. That's where, again, like Pathomo emphasized, this is what's important, this is the broad picture, and then your lectures emphasize the details that you should know. This book gives you the broad, big picture, what's kind of high yield there, and then the details from the lecture kind of came into finite. In addition, first aid has a couple of those details, and then your practice questions are going to hit those details as well. So that's something that I would recommend reading. It should be on there. It's a nice immunology book. It's like, I don't know. I can't remember what the name of the book is. I can pull that up in a second. But definitely try to check that out if you struggle with immunology. Okay, so Stecker Pearson. So over the break, first aid. You're going to read first aid like 2 or 3 times before step 1. There's no real need for you to do it a 4th time necessarily. You can study first aid, but you trying to take first aid and cram it into the 2 weeks that you have off, or 3 weeks. Yes, How the Immune System Works. That's the book. Thank you, Clay. Taha. I'm sorry, Stecker. As far as using first aid, I wouldn't recommend try to do all of first aid. You can use it if you're studying a particular subject, but it is very broad. First aid is not that great as a review resource. It's good at a high yield resource, but it's not that great for kind of some of the details. So right now you have the time to hit some of the details, and your review should be associated around that. And so try to learn and figure out the big picture, then the details of a subject that you really struggle with. So if you want to use first aid for your big picture, but then go back to your lectures sort of to dive into some of the details, particularly within that subject that you don't like, then I would do that. Okay, Taha, okay, thank you. So we have 6 weeks before we dive into pathophys. Yes, so Path, Micro, and Farm are going to be hit up front in your term 5. So it's going to be kind of the same that you've been doing for your term 4. Really work hard on that Farm section. And then when you hit Pathophys, Pathophys is like, there's nothing really new there. It's sort of just everything you did in physiology and then pathology. There's not really that much new that's in pathophys. There's a few things like in the GI system that's quite important to pay attention to during pathophys, and cardiology especially. So those 2 sections, GI and cardio for pathophys, I would definitely attend those lectures, pay attention. Cardio has all the new EKGs. You're going to get on test questions. So definitely pay attention. Those lectures are really good. And the GI sections talks about some of the weird disease pathophysiology and the wording that they ask, like especially gallbladder related and liver related diseases. They're really particular on the wording there for pathophysiology, and that does come up on STEP, so pay attention during those lectures. The last one I would say for pathophys that's important is skin. Since you haven't had a skin lecture at all, that's a good one to also pay attention to. Obviously, I'm not supporting don't pay attention to pathophys lectures, but most of them are not that important other than cardio, GI, and then the skin, because everything else is kind of review. Okay. Let's see. Okay, so how do we go about studying Taha? Again, we'll answer those questions. I hope I'm saying your name right. Okay, so thank you, Clay, for posting that. Everybody, if you look in the live chat, he posted the name of that book, How the Immune System Works, and the link to kind of pick that up off of my page. It is a very nice book. It's very short. It's like, I don't know, 70, 80 pages, something like that, not even. Very short, clear, concise. The chapters are kind of nice and condensed, and it gets you a nice big picture, and there actually have some really funny pictures and descriptions of things in there that help you remember some of the things. Then go back to your lectures for the details, and you'll really remember your immunology and be able to approach a lot of the questions. And if you have, again, any further questions from things about particular things like immunology specifically, message me on Facebook or post it onto my Facebook page. I'd be more than happy to help that, explain that, because you're probably not the only student that has those questions. Okay. Okay. Onion Brown. All right. So doing a lot of question helps. I'm talking about post-read and review of each subject. Kanyan, I did not see your original question. Did you ask one? I did not see your original question, Kanyan. But as far as doing lots of questions, yes, it's very helpful. Doing lots of questions for certain classes like Pharm is more helpful than doing lots of questions for other things. Sometimes it's better to actually read and review than it is to do practice questions for certain things, like anatomy. Doing practice questions isn't going to help you as much as actually reviewing everything in anatomy in a body system. Okay, so I think that's most of the questions for right now. I will answer the remaining in our next question thing. So let's go ahead and talk about question banks, since that was a lot of the questions here. So during term 5, like I was saying, stick with your Pharm questions, do as many as you can for Pharm. That's important for Pharm specific. Okay. The second thing is everyone, and you're going to have those OCG meetings with that one guy that tells everyone that's going to fail and freak everybody out, which isn't true. Yes, some people do, but don't freak out. If you can put your head down, work really hard, work with other people, get what's the strong understanding of information, do some practice questions, and then get to those exams, you're going to do just fine. It's very, very small percentage of people that just don't study, or they're going out and partying up bananas or something like that, that they're the ones that are going to be struggling with some of these exams. So when it comes to question banks during your term 5, and you're going to be thinking and hearing from everybody from upper term, do all your UWorld questions, and then when you get to designated, you can do a second or a third pass on UWorld. Well, if you do that, you're wasting UWorld. And I stand very strong on this point here, is that UWorld is a study resource. It is not a practice doing questions resource. You have other things to waste doing just practice questions, getting fast at doing exam questions and stuff like that. No, it is a study, almost like a reading resource that will add a little stress of asking questions. That's what UWorld is. Now, imagine you're in term 5. You're studying micro, you're studying path, you're studying farm, you're studying for your clinical exam like OSCEs, and then you have all this review classes, and you have all this homework, and you're going to the hospital, and you have small groups, and then if you're leading DES sessions, you're spending time doing that. Then you're like, okay, I got to do tons of questions on UWorld, right? Not only will you be shoving UWorld at the end of the day, or after all this stress and everything, you're really tired, not getting a lot of sleep or whatever, and you're doing these practice questions, you're like only doing 10 a day or 15 or 20, or probably lying to everybody saying that you're doing 40 a day. You're going to be wasting those questions. You're going to be wasting what those questions are teaching you. That when you get to your second round, you're like, oh no, I'll learn it on my second round of questions. No, you'll remember what some of the answer choices are, and you'll be cheating and using that question bank. Oh, just because I remember what this answer choice was when I did it and I got it wrong like 3 months ago. No, UWorld is designed during designated to be used, to be learned from, and to assess your skills at understanding all the information you learned in the last 2 years on the first time you use UWorld, which should be during your designated time. Because during designated, you read in the morning or in the evening, whenever you, and then you have an assigned question part of your day. You have 3 or 4 or 5 or 6 hours in one day to do and to focus and to pay attention and to learn from your questions. That's what UWorld is for. It's for you to be paying 100% of your attention towards these questions and learning this information. If you're doing all this other crap during term 5, and then you try to throw in questions and try to learn from it, you'll be not focused one thing, you will not be learning it, and then it ends up being a wasteful resource. When if you really, really want to do practice questions, use another resource. Use USMLE RX. Go and waste those all day long during term 5 if you have to do practice questions every day. But instead, leave UWorld for your designated time. That's my suggestion right now for your term 5. And now people are gonna be like, what am I supposed to do? A lot of students from term 5 that just completed, they'll say, oh yeah, I did UWorld a whole pass, and then they're gonna, they're trying to do all this stuff, and then they end up wasting that resource. Don't fall in those tracks. And don't listen to that OCG guy that says you got to do 50,000 questions before your step 1. Yes, you have to do all of UWorld before your step 1, but you can do all of UWorld in your designated time, no problem. You're going to have to do a lot of questions every day, and you're going to have very designated time. You can start a couple weeks at the end of your term 5, sure, if you really want to start a little bit earlier, but during your designated is when you're focused, and you should be paying attention to UWorld and using that resource properly. Don't waste UWorld. Don't try to do it all during term 5. Don't. That's my best suggestion right now. And a lot of students, when they followed that, they were very happy that I made that suggestion to them, because then they can actually learn from UWorld, and it actually improved their scores more than they said I wouldn't have been paying attention to all of these things during term 5 if I tried to do these questions earlier. So that's my suggestion. If you have to do practice questions, do it for the specific classes. Do it for farm, like I've already suggested. For micro, I know people ask me what's a good resource. There isn't really a great practice question resource. They have those quizzes and stuff on Sakai for you, and if they don't, then they're being really mean to you. reviewing and going over and over analyzing their IMCQs is another thing that can help you. And then some of my friends used micro pretest. They said that those were pretty good as well, as a nice review of micro. But remember, it's going to be separated by bug type. So it's going to be bacteria versus viruses versus mycology and stuff. So it's not going to be systems based necessarily. So just keep that in mind when you're going to those questions. You're going to have to kind of pick through which questions you are able to answer at that point in time when you're doing the practice. But a nice broad review and not wasting UWorld would be USMLE-RX. A lot of students like doing that. They are pretty good questions. So that's my suggestions as far as question banks. As far as how many I should do a day, if you really, again, are wanting to use questions, you should be 10, 15 a day. That's it, as most. That's the maximum that you should be doing a day. Don't stress yourself out. Don't try to fit them in at the end of the day. If you're going, okay, it's bedtime, but I want to try to fit in questions. No, you know what that means? It means it's bedtime. Go to bed. It's okay if you don't do some question on a day. That's all right. During your designated, you're going to hit all those UWorld. You're going to hit everything that's high yield. Bam. So it's okay if you don't hit your USMLE-RX 10, 15 questions every day. Get some sleep. Sleep's very important. Helps you study the next and following day. Now, as far as the other material that I've had some questions from students are, should I lead a DES session during term 5? Now, if you are a good teacher and can lead a DES session and guide what's important for your students in a session, whether it be you creating questions for them, hitting the high yield points of a section, guiding them through a little lesson plan, and leading that, then you are a DES leader. And yes, I would suggest you do that, especially if you learn best by teaching. Like me, I learned best when I could take information that is very detailed and make any student, even a student that was an interior designer before and they have no science background and they're going, what the heck did this PhD doctor talk about for 4 hours today? I have no idea what they're talking about. If I can explain that information to someone from that background, then I was a successful teacher and a leader of that DS group, and explanations that I had were approaching those students, then yes, that's something that you have a skill over many other students to be able to do. In addition, if you're learning from that process, that's even better. So if you're considering doing a DS session and that's where you kind of stand, do it. It's going to be extra work. You're going to have to spend that extra time preparing, but that will be part of your actual review time. Now, if you are not great at teaching and not great at taking all those details and making a nice broad picture for everybody so that everybody from every background can understand it, but you just want to do a DS session for your benefit only, don't do DS, because you're going to really screw over some students that are going to your section if you're doing that, if you're not that great. Now, I'm sorry, like, I hate to be that, person that says that, but there are a lot of students that do that. They just say, hey, I want to do biochem because I sucked at biochem and I want to review it that way. Well, if you sucked at biochem, then all the students in your section are also going to suck at biochem too. So definitely be considering that when you're going to lead a DS session. If you are, don't try to do it just so that you can get some review time in. Also think of the students you're going to help out, okay? That's very important. Next thing is, don't worry, we're getting to BSc and CBSC soon as well. Okay, so during term 5, because it's split up into those sections, the first part of the section, you're going to have that big exam that's over like everything, right? For micro and path and everything. Then the second and third is going to be your BSc 2 and your CBSC. That's how the exams are going to be kind of broken up for you guys. So I get this question all the time. Am I supposed to be doing just insane amount of practice questions for my BSc 2? What's high yield? What are the subjects? Like, what are the questions always? BSc 2 is random. It's everything. Okay? CBSC 2 is random. It's everything. It's all what's high yield that showed up on your exams that you've already done. So in your neuro class, when you learned about cranial nerves, and whatever was high yield from cranial nerves. If the CBSE or BSE2 has a question about cranial nerves, it's going to be what's high yield that showed up on your neuro exam when you did that. So you might be going, oh crap, that means everything I need to study over again. No, not necessarily. Well, yeah, obviously you do need to review everything, but how I would approach this is a review-based session with a friend. Now, find someone that studies along and thinks the same way you do, and that's where this review session will get extra points in working. And this is what I suggest you do. This is what I did with my study partner every week. So the way I worked was I could gather all this mass amounts of information and teach it. And I can confine it in clear, concise. Here's the details that's important within these sections as we're going over this broad subject. And then I could question my study partner. So she benefited from my ability to teach pretty well. At the same time, she likes a little bit of added stress because I'm great at making hard questions. And then I would ask her and go over that. And we'd spend 2 hours over a body system. So BSFCR is going to be like this. You go in, this week is cardiovascular system. You're going to learn everything from EKGs to cardiomyopathies, everything. And so as far as the cardio system, organize it the way first aid does. And if you open up your first aid to cardiovascular, you're going to see things like this: histology, embryology, anatomy. Then it's going to go into your pathologies, right? So pathology, whether that's histopathology, pathophysiology, and stuff like that, and through the subject. So you take a system and it's broken up subject-wise within that system. And that is how you review with your study partner. And you might be thinking, well, we're just going to read first aid together. No, you're actually going to do more details than your first aid. Open up every lecture from histology about cardiovascular muscle. So cardiac myocytes, it's going to be one lecture, really easy. So it's going to be a simple review. It's going to take 4 minutes to review cardiovascular muscle compared to other muscle types. You're going to say, these are the fibers. This is what a muscle fiber looks like in the heart versus your other ones. It's a striated muscle type. Here are your little intercalated discs right here. That's the thing that when you see that histology, you go, I'm in the cardiac myocyte, and that's your histology. And you go, okay, now let's go on to your physiology of the cardiovascular system. Now, don't open up every single lecture from the cardiovascular system physiology, because that's a lot. We're going to say, here's the high yield points. Here are our pressure volume loops. Here's the general flow of the cardiovascular muscle, or the blood flow through the heart. Here's the anatomy structures related to this, like blood vessels, chambers, different valves, blood, large vessels coming off of there as well. So getting a nice histology, embryology even, which is very important for cardio specifically, and your anatomy, and then your physiology, and then all your pathology, and then if there's any related microbiology in the microsystem like endocarditis, myocarditis, pericarditis, all those things come up. And then lastly, what's the pharmacology? So you organize your studying in details, reviewing from those lectures that you had in that system, in the way that first aid puts it, in the order. Now that is going to be a great review. If anyone has any particular questions about that further, I can answer those at the end. But that's what you should do, is you should have that review session, spend 1 hour breaking down everything that you learned from histology through pathophysiology. Have those lectures open up, look at some of the pictures. This is a electron micrograph for this. Click, 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 really, really fast. Looks like rapid fire. Remember this, remember this. Oh yeah, that's what, right. It's going to be like a sudden dawn on moment, like every 5 seconds. Like, oh yeah, that's what that cell looked like on histology. Oh yeah, that was the weird thing on electron micrograph having to do with this system. Oh yeah, that was the weird physiology that I reviewed. Oh yeah, here's the little graphs. Okay, let's break this down a little detail. Oh yeah, that's what the graph's happening here. This is what this is. And this is a nice detailed review that when you look at first aid, it doesn't have any of that in there. Or it might have like, yeah, the cardiac cycle or something, or here's some of the math problems. But there's going to be a lot of things that your lectures actually cover that then are going to show up on questions on your step one that first aid did not hit. First aid is not a comprehensive thing at all. It's just a high yield kind of thing, and it misses about 20 to 25% of what you're going to need for your step one. So that's where your review kind of comes in. Once a week, pick a system, maybe even doing whatever system you're doing that week. Spend 2 hours outside, enjoy the sun, and just kind of break all those things down. That was the best way. And if you have a whiteboard, you can draw certain things out if you have to. That's my suggestion of how to review everything. And once you do that once a week for every system, you finish term 5, or you get to your BSc 2 and you go, damn, I remember all these details. And guess what? A lot of those questions in BSc 2 are going to be those details you reviewed that are not going to be in first aid. Bam, you got that point right there. Anatomy is very high yield, always for BSc and CBSE, as well as for your step 1. So if you struggle in anatomy, start working on it right now. Okay, so that's my review section advice for that. So before we go into after term 5, let's go ahead and answer some of these remaining questions that we have here. Okay. Okay, can you say something about how to learn and remember all the details in pathophys in each subject we need to review for STEP? For example, some people rely on flashcards they make to sets they downloaded like Zenki. Other people annotate a first aid while they watch Boards and Beyond. I wanted to make sure I'm spending time wisely in term 5 by investing time in actively learning. But it can be hard to decide the best approach that is also an efficient use of time. Aside from questions, okay. All right. So, other resources during term 5, yes. If you're reviewing and you're going over your first aid, I would suggest doing Boards Beyond with it and annotating. That's nice. Keep in mind, that's going to be a lot of time. And so if you are one of those people that want to get to your understanding of 80 to 90% before you do practice questions, Boards and Beyond is going to be your savior, because it's going to be a lot of time of reading and a lot of time watching videos and a lot of time of reviewing a lot of the details, even ones that first aid does not cover at all. So Boards and Beyond is a fantastic resource, especially neuro and for cardio and for renal as well, lots of electrolyte stuff. But it is really great. Boards and Beyond is a fantastic resource and very nice to use that over. Zenki, on the other hand, I hate flashcards. Hate flashcards like no other. So if you love flashcards, go for it. However, I would not be using that as a main resource of studying, because when you're going to get a question that says, what's the fourth word in this sentence that's missing on a question, and then they give you multiple choice. No, like that just doesn't happen. So the way you're studying with Zenki is to recall minute details in a weird way that you're never going to get a question in that same weird way asking about that thing. It's going to be something almost seeming foreign to you, rather than understanding the broad concept and thinking, okay, how do I write a question about this? Or how would a question approach this topic? And thinking more broadly of how a patient would present, what are the symptoms, what's the physical exam, what's the imaging studies or something like that, findings, and then bam, I have my diagnosis. Thinking of it that way and actually reading and studying over material is going to help you on questions more than doing flashcards. Now, when you guys get over to your rotation time, I changed my mind about flashcards a little bit, but only for memorying. I do not use Zenki. I still don't suggest it. But if you love it, you use it. That's fine. I just hate flashcards, so I don't make that suggestion to anybody unless they absolutely love it and they can learn everything that's going to be helpful. Just keep in mind there's like a zillion Zenki cards to do. You're going to be spending a lot of time, and it's going to be very hard to recall that information, even when you're doing the flashcards multiple times during a question. You're going to be like, okay, was that flashcard 473 of 65,000? It was asking this one particular line and stuff like that. And then 5 minutes later, you answer that question, and now it's too late. Your exam ends. So that's where Zenki kind of fails. is it tries to get you fast at recognizing what this flashcard is emphasizing, but when you get to actual exam questions, it's very hard to think of differentials and stuff like that. That's where reading and studying things are going to help you more than doing flashcards. And Nick, yes. Yes. Designated is after term 5, before step 1. Students, please be aware of the change in the curriculum for term 5 students. Yes, I did address that earlier, that the curriculum is a little bit different. Okay. I think it means changing 2 exams, new material before BSCE. If anyone else has any questions, go ahead and type those up right now. So as far as BSCE, so BSCE 2 will cover everything that you've covered up to that point in time, because it's like your second midterm. There's still going to be material after your BSCE 2 that you'll be learning in pathophys and stuff that they won't include on your BSCE 2. So BSCE 2 is not a great representation necessarily of where you stand for step 1. CBSE at the very end, your final, is going to be a nice representative as you start your designated of where you stand around plus or minus 15 of your step scores. So if you're scoring in the 80s on your raw scores, you're up in the 220s already. So keep that in mind as far as equivalent when you start your designated time. Can you sum up what you've said about using other resources in combination with what you said a few minutes ago about your overall approach to review all subjects? Okay. So, I think you're asking me, what resources did you use during your review with my friend each week about a system? I think that's kind of what hopefully that's what you're asking about. In regards to that, lectures had nice details. They had pictures there, which was nice to kind of go back and flip through really fast, rapid fire, like, oh, that's the histology. Remember what that looked like. So pulling up all those lectures, going back on Sakai and pulling up all those lecture PowerPoints, kind of sifting through what I was about to cover in my histology of cardiovascular muscle and my physiology, graphs and stuff like that. I tried to get that from the lectures. But then things like pathoma, I struggled kind of being able to fit that into the 2 hours because every system has a lot to review. So I just anticipated, and my study partner did feel this way as well, that we both felt that we were pretty strong in pathology, so we didn't need to add that necessarily to our review time that we had each week. So we kind of left out different things like micro and pathology we were both very strong at. So we both felt, let's leave that out of our review. I think we're okay. If we have any particular questions about that, we would bring it up during the session, like, hey, I forgot my endocarditis bugs. Can we review those really fast? So those certain things like we did, or else some systems we just didn't talk about micropathology. Pathophys isn't really anything new, except for a couple things like some EKGs. So when we got to cardio, I did cover those very quickly with her. Just like, oh yeah, remember we had this lecture a month ago in cardio pathophysiology, and we're just like, okay, these are the things that you point out for the EKGs when you see these are associated symptoms and complications, and how do you fix that arrhythmia if we learned that. And not often did we talk about pathophysiology during those designated. It was really mainly how do we approach during our review time all the normal class subjects we learned. So what is all the normal anatomy, normal histology, normal physiology, and then maybe approached our pathology related in there. Yes, that is the organization of first aid, like I was saying. So you would like to approach and review everything from your histology to your pathophysiology. But if you're strong in some of the subjects where you literally just learned this week your pathophysiology of cardiology, like, you don't necessarily need to add that to your review because you're already doing that. You're learning that in the class right this week. So just review all the other things that you haven't since last year or whatever, your biochem and everything, if it's related to it. And so making those connections between your subjects for a particular body system is super important. Like if I took cardiovascular and I asked you guys a question, what biochemistry diseases are related to problems with the heart? Well, there's a whole bunch. There's a lot of genetic diseases and stuff like that. And some of them are like enzyme deficiencies, where you're talking about glycogen storage disorders or lysosomal storage disorders. Some of them have cardiovascular involvement, right? So what are those? That's a nice connecting review between cardiovascular and remembering what your biochemistry is. So that's how you can make a little connection right there between those. For example, Pompei's disease, right? So that's how you take all the review in that system all the way back and include all the subjects. Try to. There's always a few examples in every subject that can hit that system that you're dealing with, except for biostats. That just doesn't apply anywhere except for its own review week. Okay. Do you think it's smart to give your entire designated step time to the program like Kansas? Okay, so Kansas is, I think, 10, how many weeks is that? 6 weeks, 6 weeks, I think. And you guys, I think, have 7 weeks. So let's go ahead and dive into quickly about the designated study programs. So this is something to think about, okay, and something to do a little. You can actually, over this break, I would suggest doing this. I would do a little research into the programs. But first, before you go into research of these programs, stop to think how you study, how you learn best, and what you will learn best by. In addition, you also have to consider how much money you have to put into some of these programs, because they are pretty expensive. However, all of them are, I think, worthy investments for your studying. Some are more worthy than the others, and I will explain that. But you have to stop before you do your research and think, what type of student am I? And so the three main programs are 1, lecture-based, 2, group-based, and 3, private tutoring-based. Those are the 3 kind of main programs that you have. Oh, and then 4th is self-study, which I wouldn't suggest to anybody unless you absolutely had to or couldn't afford it. So if you're a student that likes running drills, someone really pressuring you, answering questions, putting you on the spot, making you run over things in rapid fire, going really quickly, working in a group, thinking through complex cases very fast, and doing that every day for 6 weeks or for your entire designated time, then you're a student. If you learn best that way over anything else other than studying on your own, having a private tutor, then you fit best for the Kansas program. Why? Because that's exactly what they do. Every single day, Monday through Friday, you will wake up and you'll be in a big group, maybe 6 or 7, 8 students, for a couple hours, and you're going to run drills on a particular subject. So that we're talking about cardiomyopathies today. We're going to break down what is the histology, the pathophysiology, the patient presentation, stuff like that. And you're going to kind of rapid fire. You're going to be asked questions about what you think this diagnosis is, how to treat it, what you should do. And if you get it wrong, you're going to run that drill again. And then after a few hours, you break into smaller groups and you do certain things more in detail, and then into even smaller groups. And then you can kind of have your one-on-one with the tutor for an hour or something. And then on weekends, you pretty much break down doing practice exams, your NBMEs, your year-old self-assessments, doing lots of practice questions. And those are your weekends. And so if you learn that way, you're fit for the Kansas program. And my study partner, I created very hard questions to ask her, and so she felt very comfortable in that role, being asked questions. That's where she really enjoyed doing that program, is because she liked that kind of pressure on her. And so there's a lot of students I know that like that. And so if you like that, I would highly, highly suggest doing that Kansas program and do a little bit more research on that. Now, if you're a student like me that likes to study, take information from tons of detail, figuring out what the big picture is, figure out analogies, and then what's the details of that, and getting to a point where I can teach it to myself even. And I really want to feel comfortable with reading my own material figuring out 85, 90% strong on that material, then doing practice questions. And then if I have any particular personal questions about information that I'm learning this week, or any questions I did on UWorld that I got wrong, or any of my NBME practice questions that I got wrong, and I wanted those particular questions personally for me answered, but then I can study my own kind of thing, like, here's a schedule for you. This is what you need to accomplish for the day. And then I got to use my own skills of time management for that whole day just to accomplish all those things. But I get to do it on my own time at home. Then you're best fit for a private tutoring service like med school tutors. Why? Because you get to study sort of on your own. You get to accomplish certain things every day, kind of check those things off. Someone writes a schedule for you each week. And then any particular questions that you specifically have, you get to ask that tutor, and that tutor might ask you some questions, but we're not going to be running drills every day, asking you questions every day. No, it's just meet once or twice a week for a couple hours each. And it's nice someone to have you held accountable, but make sure that you're studying everything and then answer your questions appropriately. That is what a private tutoring service sort of does for you. Is they formulate your thinking process, they answer any of your questions, they make your schedule for you. It's very personalized, and that is what MST does. That's the company that I work for, but there are other companies out there as well. So that, if you feel and learn that way more, then you probably be fit for a private tutoring service. Now, the third type is those that really love lectures, which is very rare nowadays that people like lectures. Now, if you like lectures, and better lectures than St. George's gives, and you like kind of just watching, observing, and then writing down your things, thinking about it, studying your own, and then doing your practice questions without anybody really necessarily holding you accountable for anything, because you could do that for yourself, then Kaplan might be the best thing for you. I have heard of a few students during term 5 do an entire Kaplan program during their term 5, and then they did another program during designated. I wouldn't suggest that, because you're going to be super busy and super stressing yourself out, unless you're an insane nerd, nerdy, then you can do that, but I wouldn't suggest that. But if you like lectures, that's kind of where Kaplan does, and I think they do. If you do a program with Kaplan, they do have some small groups where you discuss different things, but it's definitely not a drill running thing like your Kansas program has. Okay. All right. In terms of dates, how much time the September entering class have the designated study time in order to start rotations? So for yours, if you're ending your class, I believe in like June or May or June or something like that, I think you have to take your exam by July 15th. So I think you only have like 6 weeks, 6 or 7 weeks, something like that, after your term 5 to do your designated, where if you're in a January entry class, you have about 10 weeks before kind of the deadline where you're going to be entering with everybody else that took your exam on time for rotations. Now, if you take it a little bit later, you only be about 6 weeks behind. I mean, I know some people that delayed it like months, which is crazy. I don't know why you would ever need to do that. But for the plus 6 weeks, you would just enter one rotation behind everybody, because there are 6-week rotations, right? OB-GYN, peds, family medicine, those are 6 weeks. So you would only be 6 weeks behind everybody when you kind of joined in. However, your choice of hospital is now gone. You're most likely going to be going to New York or New Jersey. So if you're a California patient, MA, I don't know who that is. If you're a California person or somewhere that you want a hospital particular near you or something, and it's not in New York or New Jersey, then if you delay it past that designated time that they say, you got to get your step 1 done beforehand, which is probably like July 15th, something like that, then just keep that in mind that you're going to be doing rotations away from home most likely. Because they only give priority to the students that do your exam on time to where you're kind of hoping to get into, or like asking, requesting, which you'll get during term 5. You get a list of hospitals for rotations, and you'll say kind of rank them on where you want to go and give a reason kind of why. All right, any other questions at this time? If not, let's go ahead and just hit that last kind of miscellaneous points that I have at the end of the session. And those are, what do I do to prepare before I go back to the island in term 5? Okay, if you have a car on the island, start posting your car online for sale if you can. If you're renting a car, no worries. You actually took the better way out. I had a car down there. It was horrible trying to sell it. Other things are, go to the post office or wherever you can, usually post office, get a passport size photo of you while you're here in the States, and it's cheaper and you have a little bit of time over this break. Go get a few passport size photos and bring those to the island with you. You will need those for some of the paperwork. You sign up for rotations during the island. Might as well get it now, save the time and stress trying to figure out where you can go get that photo all the way down in Grand Anse or something like that. And yeah, so that's just one suggestion I would have. The second is, during this break, if you have to study, do as little as possible and really hit a subject you hate. And then the other thing is, try to relax, enjoy your Christmas break. This is one that you'll get right now. Some hospitals, I know people are doing rotations and they're stuck. They have to actually work over Christmas, which sucks. I get the break off, but there are a couple, like in California, that they just decided to start their rotation this week when Christmas is next week. So if you enjoy time with family and such, keep that in mind. So enjoy it now. And if anyone else has any questions, go ahead and type those. I think this is pretty much the end of the session. If anyone had any particular questions, I would like to answer those now. All right, we'll give it about 30 seconds later. All right, well, you guys had some great questions. I hope you understand that there's going to be a lot of coursework and things that you're using during term 5 or doing during term 5. If you have free time and you're good at teaching, I would suggest doing a DS session. And for your designated time, be doing a little bit of research, figuring out what type of student you are and then what program you kind of fit best with. And that's something to sign up for as soon as you can during term 5, maybe midway through term 5. And if you guys have any other further questions, go ahead and post those on my CK Med page. I'll answer those there. Stecker Pearson, I saw your question. You only need one, but you maybe bring like down 5. Usually, like, they'll often print multiple of them, like 5 or 6 of them. Just bring a few of them in case you bend some. You just have some paper work you have to fill out, and you have to have this little picture of your head, a passport photo. The best thing to do is actually go and get professional photos now. You're going to add this to your CV letter during your 3rd year when you're going to fill out, or 4th year when you're going to apply for residency and stuff like that. And in addition, you're going to have that photo with you when you go to ask attending physicians for their letters of recommendation during your rotation. So might as well start writing your CV now if you can, just a little bit, just sprinkle it in there. OCG website kind of breaks down a nice template you can follow. It's very, very easy. It takes like 20 minutes to write a CV. It's like all it is a resume pretty much. And you can fill it out as you go over term 5 and year 3 of med school. And if you get professional photos, like you in a suit or professional attire for women, and get a nice, very professional photo, like actual nice size, like this photo, like the wallet size ones, and then even larger ones if you can get it on digital, and then also with the little passport size ones that you can bring for the island particularly. You can have those larger ones that you hand to doctors when you come back to the United States or wherever you're doing rotations, maybe in the UK, when you hand them like, hey, here's my CV, here's my photo, can you write me a letter of recommendation? Now you know who I am, here's my application. And then they can write you a letter of recommendation. So it's nice to have those pictures. Might as well do it all in one. I'm actually going to do that this week. Go get a nice professional picture. So do it all in one. Then you have your little passport photos you can take to the island and use for that purpose as well. What would be a safe score now for residency? It depends. So John Ho, it depends. So if you want to do pediatrics, the average for most programs of a step 1 score, average, meaning there are a lot of students that apply and get residency that have lower scores, is around 220. 215, 220 is what pediatric programs. That's the least competitive, however. The most competitive, on the other hand, is going to be dermatology or otolaryngology, and those programs scores are around 250. And those are for US students. So if you're wanting to get one of those, which is nearly impossible, is going to be a 260. I mean, not nearly impossible that you can score that, but there's very few programs, and they don't often take SGU grads. Dermatology maybe, because there's a lot more of them, but it also is the most competitive. Or otolaryngology has very few programs, which is head and neck doctor and a surgeon as well. And so, but keep in mind, you usually have to score around 10 over US students to kind of be comfortable in applying for those things. So if you're looking for pediatrics, you want to score in the 230s, maybe would be a very nice position for any residency program in pediatrics, family medicine as well. Internal medicine, they're usually looking for students in the 230s for US students or 240s in IMGs. But that kind of, again, depends on the program. So some of them are 220s, 230s for internal medicine, but it really kind of depends. So how screwed are people who don't match into residency? First, from SGU, it's a very small percentage. I think it's like 4% or something like that. Don't get a residency matching, which means that those 4%, in those 4%, does not mean that they didn't get a residency. Some, about 2% of, or like half of those, I mean, 2% of the total students actually get offered jobs on the spot from the hospital. And so they don't do the match. And so they are considered non-matching students. They actually just get hired by the hospital straight off in the interview. And so those are very good students. And so those are not considered in the match. The other about 50% of those that didn't match in the matching thing are ones that truly didn't match. And now a lot of those students actually come back to the island and lead pathology groups. There's some of your clinical tutors that you saw there are a lot of students that did not match particularly, or there are some that didn't want to match. So remember, they have to consider all the students that are graduating from SGU, and so some of them actually just want to go and be teachers. They're not applying for residency necessarily. So that's some of the considerations there. How screwed are people? So it depends. If your score is a 197, which is like just over a pass, that's going to be really hard to get residency. Would I suggest taking step 1 again? I don't know if you can. That I would have to ask administration at SGU if that's even a possibility to take it again if your score is passing but just really bad. But some programs just could care less. They're like, hey, if you can bring up your step 2 score. So remember, your step 1 is not everything. It is very important, but your average of your board exams is more important. Your step 1 and your step 2, which is split into 2 exams, your CS, which is like a giant OSCE with 12 patients, versus your CK, which is like step 1, but it's step 2. If the average is in that range, then that's where it's very important for residency. So imagine if you got a 200 on your step 1 and a 300 on your step 2, then you just got a 250. So you can start applying for very hard surgery things. You can apply for otolaryngology if you wanted to. So keep in mind that average between those 2 scores is what really is helpful. And step 2 is easier. So a lot of students improve on their step 2 score a lot. 20, 30 points, even higher. So just keep that in mind, that step 1 is not everything. It's very important, but it's not everything. In addition, your letters of recommendation. If you've worked at a hospital you're applying for, they're going to give way bigger favor to you than anybody else that just was randomly applying and they have to read everything about who this person is rather than actually, oh, wait, I know who this person is already. Now I just need to read what their scores are and I want to give them an interview. So there's a lot of things that go into residency, and that's why a very small percentage of people don't match. And if you don't, there's something that needs to be worked on, whether it be your research part of your application, which I need to work on, whether it be your exam scores, whether you just suck at interviews, you don't know how to talk to people or something like that. There's always something that can be kind of worked on and be humble about during your application process. And there's a lot of things you can still do. If you have an MD, you can do a lot. You can still teach. So keep that in mind. People aren't that screwed. You can get a lot with an MD, surprisingly. So, all right. Any other questions? Please type them now. I think the session is going to be pretty much done at this point. Okay. All right. So as far as that goes, if you have any further questions, post them on my CK Med page, and I'd be happy to answer those. This session will be live, or it is live. It will be recorded, so anybody else can come back and watch this if they missed it. And yeah, I hope everyone has a wonderful break and actually takes a break. But if you study, do a little bit of it, and enjoy the last term you have on the island. You know, bring back a bunch of gifts for people when you leave the island from the last term. I would suggest going to the store in the airport that has this wonderful, fantastic mouse pads promotion right here. They're actually fantastic artwork on here, and they're really durable. I just had one of my friends leave the island who got me, I had her get me a couple of those before she left. Because they're wonderful. But it's a beautiful picture of the island and say, hey, I've studied here. And I get a lot of people that say, like, hey, what's this? And be like, oh, that's where I went to school. It's a beautiful island. Enjoy it while you're there. And yeah, I miss the island a whole lot. I definitely am going to go back, thinking of doing a rotation down there, or the pathology rotation down there that they have specifically. So, all right. Well, thanks for guys for watching this. Hopefully this is helpful for you. And yeah, happy studying when you get to term 5. Any questions come up, you know where to go. All right, take care, you guys.